Hello everyone and welcome. Thank you for joining today's webinar focused on mental health management and digital innovation. For the conversation today, I'm delighted to have, there are four of us in total. I'm joined by Jonathan Baker, CEO of Iona Mind. I'm joined by Dr. Paul Farrand, Clinical Director at Iona Mind and Professor of Evidence-Based Psychological Practice at the University of Exeter. Joined by Ms. Aurora Bohm, our Chief Business Officer at Aptar Digital Health, and myself. My name is Damien McKeown. I'm in charge of Global Alliances and Strategic Partnerships at Aptar Digital Health. So, in May of this year, our two businesses, Iona Mind and Aptar Digital Health, announced a partnership to combine our respective capabilities to deliver scalable mental health support for chronic disease patients. And today, in particular, with it being World Mental Health Day, we would like to tell you more about this partnership and show you the value that we aim to bring to patients and healthcare stakeholders by working together. Now, during the webinar, if you have any questions, please feel free to use the chat and chime in with your comments, and we'll have a Q&A section at the end. And if we don't address all of the questions, we will, of course, get back to you after the session. So, welcome again. And maybe to set the scene, I'd like first and foremost to maybe jump in on introducing the two respective businesses. So, John, maybe a few words on Iona Mind, if you'd be kind enough to introduce it, please.
Thanks, Damien. And first of all, I'd just like to say thanks so much for hosting us. We're really happy to be here in France. We really enjoy your hospitality. And let me just start by telling you a little bit about Iona Mind. So, Iona Mind Inc. is a US company, and we specialize in supporting patients with chronic diseases through the psychological side of their journey, their treatment, and survivorship. And we do that by offering low-intensity cognitive behavioral therapy solutions, primarily in a digital context.
Brilliant, brilliant. Thank you, John. Thank you for that introduction. And again, welcome. Aurora, if you'd be so kind to introduce Aptar Digital Health, please.
Sure. So Aptar Digital Health has a mission, and it's to improve the patient experience with their treatment. We usually use two types of solutions. They can be e-devices, so connected drug delivery devices that help with monitoring adherence and also starting properly the treatment for the patient. And we can also use digital solutions that are applications, typically, that would help patients monitor their symptoms, monitor the triggers of their flare-ups. We're able to build those solutions, we're able to deploy and operate those solutions at scale, and have deployed those globally with millions of registered users in different indications. It can range from oncology to respiratory, neurology, immunology.
Thank you, Aurora. And building on that a little bit, just from my point of view, being in the partner sphere, I think it's important to say that while we're going to hear a little bit later with the help of Paul about features and about where the value is for patients, it's regularly come up with in conversations with pharmaceutical partners as to how the cognitive behavioral therapy part of the patient experience is managed. So we're again delighted to bring these conversations together, and thank you for the two business introductions both. Now, to remind those joining online, you can ask questions via the chat or send us a note, and we'd be glad to make sure we catch them. And again, welcome to those still joining the call. Thank you, Aurora, and thank you, John, for those interesting introductions to the respective businesses. And the next thing I'd like to look at and talk about is as partners. Where our ambition is, of course, to develop combined solutions to bring at-scale mental health support to people suffering from chronic conditions. And I'd like maybe to understand a little bit more about how the partnership started, Aurora.
Sure. So while we support patients with their drug and treatment experience, we've realized over time that the mental health was a key element of their daily journey and what matters to them. I have an example. Multi-years ago, we started to work in oncology with patients in the study, trying to help them with their gastrointestinal toxicity, pain management. And within that study, they were also filling mood questionnaires. And just a simple mood tracker was really perceived as very valuable for those patients. So we got the conviction we had to also be involved in there. And a tracker is not an intervention. So we said, okay, we need to go further, have a proper intervention and a proper partner for such features and modules in our solutions.
Very interesting. Thank you, Aurora. And to complete that, I mean, as I saw it from a partnership point of view, the features of the respective solutions coming together is what brings the value to the patients. But we also have regularly in our conversations with pharmaceutical partners the question around how are you helping support the mental health part of the patient experience. So this is a natural fit for a pharmaceutical partner looking for this kind of solution, and we're delighted to talk more about that in a few moments. So now, just going to pause for a moment because folks joining online, you can ask questions via the chat, so please feel free to jump in and ask questions. Thank you. So, thank you all for setting the scene and explaining to the audience joining us live today the story behind our partnership. Let's now jump into the main topic of today's webinar, which is how exactly can we help patients better manage their mental health. And I think, Paul, with your help, could you maybe take a moment to explain what aspects of mental health in particular we're talking about here?
Okay, so if we think about what mental health difficulties are, and about 1 in 6 people experience mental distress every week, around 6% of those difficulties with anxiety disorders, 4% difficulties with low mood, depression, and they have a significant impact on us in about 4 main ways. Thoughts, our beliefs that go through our heads, our behaviours, what we do or what we don't do, are in physical, how we feel physically, and that's why we can't separate mental and physical health. This is what we've been trying to do for hundreds of years, and it's simply not. Anything that goes through here manifests itself through here. And then also what people talk about is the emotion, but there's lots more to a mental health difficulty than we're just facing. And the reason why we need to manage this pandemic, we've been talking about the COVID pandemic for years. We've had a mental health pandemic for centuries, if you like. It's grown over the centuries, but now it's in crisis. And we're paying attention because it's having significant impact on the person, on their physical health as well, but also their loved ones, their employers. If we have a fit, healthy workforce, productivity is greater, and positive work is good for people's mental health. And then also, the good reason why governments and mental health systems are getting involved is gross national product, in that if we have a healthy workforce, healthy population, we're actually more productive. So really, our collaboration is about understanding the medical and the psychological mental health to actually achieve the improvements actually in the physical and the mental health perspectives.
Fantastic, very interesting, and thank you, Paul. And if I could follow up on that, at the very outset, as Aurora talked about the Aptar Digital Health focusing on the patient experience, perhaps we could look at the journey, the patient journey, and could you, in your clinical experience, give us a sense of what that journey looks like for patients today?
Okay, well, currently it's a bit of a muddled journey, simply because we still got the physical and the mental health workforces, which are actually separated. I'm embedded, I'm a consultant psychologist in oral and maxillofacial and head and neck, and I work very much embedded within physical health settings, so I'm slightly different. But what we need is a greater connection between the mental and the physical health, and digital technologies potentially provide that greater connection where we can start establishing collaborative care. So everyone's business is everyone's business in the other areas. And potentially digital technologies can bring those together in a number of levels. But the journey is, at the moment, characterized in terms of obstacles. So we have different workforces, we have different waiting times for different workforces, it's non-accessibility. And as we said earlier, the mental health is affecting the physical health and vice versa. But there's no single workforce or way of working around both at the same time. And that's what we need to address. and potentially digital technologies provides a cost-effective, efficient way of doing that.
Great, very interesting. Thank you, Paul. Thank you for setting the scene. And now, John, maybe I could turn to you for a moment, because as we think about Iona Mind's solutions, I understand that a specific focus, and when you founded Iona Mind with your colleagues, is on low cognitive behaviour therapy programs in particular. Could you explain what this is, how this works for our audience, please?
Yeah, exactly. We really specialise in a low-intensity forms of cognitive behavioural therapy. And the reason we do this is because we want to offer our patients, offer our end users evidence-based but critically accessible and scalable mental health solutions. So at our core, Iona Mind is all about tailoring our solutions to the particular population at hand. So to give you an example, when we're working in the US with head and neck cancer patients, a very common component of that disease is you may not be able to speak, you may not be able to access a lot of the evidence-based therapies for common mental health disorders. So very effective, very common treatment for mental health disorders like anxiety and depression is cognitive behavioural therapy, talk therapy. Mm-hmm. But if you have head and neck cancer, a common symptom of that is you may not be able to access the therapies because you may not be able to speak, you may have difficulty talking. So one of the ways that we offer a solution to those patients is by taking these evidence-based talk therapies and translating them into a fully digital experience where the patients can access evidence-based scalable programs, but get the full therapeutic dose without having to engage in face-to-face talk therapy. So they can engage through all of the programs through a digital app. They can access automated support through the app. They can do it in the comfort of their own home, and they can access it 24/7.
Very interesting. Yeah, and that really makes sense as we understand the low intensity cognitive behavioral therapy programs you guys have set up. Thank you, John. And now, if I could turn to Paul, maybe did you want to say a few words to complete that?
Just to build on what John was saying, currently psychological therapies tend to be quite intensive and require a lot of patient time and effort. So you need to tend to travel to locations where you're going to be talking to therapists for an hour-long sessions, which can be quite a lot require a lot of concentration or physical stamina, if you like, to engage with that. What low-intensity cognitive behavior therapy offers is it's briefer chunks of time through an app. People can engage with it for 5 or 10 minutes at their own convenience in their own home. So it's lowering the barrier, and what we call is around treatment burden. Mm-hmm. If people have physical health problems, they focus and they prioritise the physical health. So the mental health tends to get pushed to the back because the treatment burden of physical health alone is enough. Low-intensity CBT is ideally suited to a physical health population because it's reducing that treatment burden. So for the first time, patients may be opting in to manage their mental health alongside the demands of their physical health.
Sure. Very interesting, Paul. Thank you. And if you could perhaps build even more on that, the patient's unmet needs in particular, when it comes to their chronic disease and mental health management, how would you talk about the unmet needs part? What's most important in your mind when you think about the unmet needs?
Okay, well, there's two things there. The first thing is we have something called a mental health treatment gap. So we know for problem drinking and addictions, which is an element of Iona, is about 80% of people who have problem drinking or with addictions don't get evidence-based psychological therapy. That's about 65% for generalized anxiety disorder. So we already know that the people who are experiencing psychological stress or the resultant behaviors are not seeking evidence-based or not getting evidence-based treatment for a variety of ways. The reason why it's important to focus on the mental health running alongside the physical health is because if we improve mental health, we can improve also the effectiveness of the medical health treatment, of the medical treatment, We can improve what we call concordance. Mm-hmm. So that's taking medication as prescribed and as required. And the benefit of this is we have a healthier, a quality of life can improve. We're more likely to be successful with the medical inputs we have. So we're addressing two problems at the same time, but with the same treatment burden as previous.
Sure, that really does characterize the unmet need, and maybe maybe you could give us an example in a specific therapy area that speaks to this.
Okay, so if we broaden the scope a little bit around renal medicine,
Yes,
and dialysis, hemodialysis, and renal failure, what we have there's several procedural anxiety disorders. Medicine is going through a big shift and is trying to increase self-management, simply because we're keeping people alive longer, to put it bluntly, with long-term conditions. And therefore, one of the ways the medical systems are trying to put more responsibility for people's self-management onto them, moving them out of hospital settings. But we know people can dialyse at home and themselves, but there's procedural anxieties. So, for example, needling and self-needling. We have training programs which will teach them how to self-needle, but if their anxiety is too great, they won't even entertain what we call pre-contemplative. They won't even think about engaging with those systems or training. So we can address the procedural anxiety through things like exposure therapy and through different digital approaches. And then that can move people then through the medical procedure and medical course of treatment, once again for the benefit of the patient and for the healthcare service.
Yeah, very good. And again, you're coming back to that at the end. You're enhancing the patient experience in doing so. Yeah.
And if I
Very
may,
good.
Damien, I think it meets a trend we also see from pharma, that they want to bring treatments for the patients at home so that it's more convenient. They can also self-administer a lot more treatments right now, but we also have to empower them with the right tool to self-administer, but also to manage the anxiety and the responsibility that comes with it. So this is where we see that the trends that are going towards the patient at home are actually joining, and where digital solutions can focus the attention to the patient who's receiving care. So
very good. Very interesting. The next thing I'd like to take a little bit of a closer look at, folks, if I may, is maybe the actual real-world illustration of some medical cases. And what I'm thinking about in particular is where Iona Mind and Aptar Digital Health combined solution would be valuable for the patient experience. Paul, if I can start with you, perhaps an example that you could walk us through?
Okay, well, drawing on my own experience as a consultant psychologist in head and neck, what we're doing with Iona is obviously we come across, because it's affecting this part of the body, and this part of the body is very outward facing and people make judgments, etc., then it can raise a lot of anxieties or affect people's mood. And that's obviously, in my input around that, is addressing anxiety disorders that people may have, also around communication. So what we can provide is the low intensity CBT through a digital app to directly address those. And we're doing some research at the Carbone Cancer Center in Wisconsin.
Okay.
And we're beginning to test the effectiveness of the Iona app in basically, does it help people manage those anxieties? Does it help people manage their low mood? But once again, it's focus on treatment burden. People are very receptive now to using the app because it's not taking away from their focal concern around their physical cancer in their head and neck, or indeed we're focusing on chronic pain. In head and neck, I often meet people with something called temporomandibular joint disorder. This is where the physical meets the psychological. So people are stressed or anxious. One thing that they tend to do, and we all may do it when we're stressed and anxious, is they clench their teeth.
Yes.
That's what we call bruxism.
Yep.
And that can cause pain, atypical facial pain. The way we address that atypical facial pain, which we've just realised, is rather than going for test after test after test, and the medic's not finding anything, they can send them to me, or we can use an app. We can manage their generalised anxiety or their anxiety disorders. That reduces the bruxism and it reduces the pain. So the medics can focus on the medical part, and the app, in my case, the psychologist can focus on the psychological parts.
Very clear, very interesting. And perhaps, Aurora, if I could turn to you, are there other medical cases that might come to mind?
Yeah, I think a good one we thought about where Iona and Aptar Digital Health solution really bring value to patient and pharma is dermatology. I'm thinking of skin disorders such as atopic dermatitis or psoriasis. In this indication, we provide solutions for patients to self-inject because usually they get biologics, but they have to self-inject on top of topicals. They also have a need to monitor the evolution of their lesions, and for that we have solutions with picture imaging, analysis, etc. But we actually see several sources of anxiety for those patients. Typically, we mentioned needle and self-injecting is something that triggers anxiety. And there's another aspect, is the disease itself is impactful for the patient when they have to go outside and socialize while they have visible skin lesions. So if people want to help really the patient throughout all the dimensions of their treatment journey, associating the hardware, the digital solution for skin lesions and the CBT support through the app is actually what's going to impact the patient and probably get them through the whole journey and with a better adherence in the end to their treatment. Okay. So that's a use case where there's synergies of addressing mental and physical health.
Okay. Thank you.
Could I just come back in?
Yeah, please.
Sure.
And another element, another overlapping, which shows how all these areas of mental health difficulties, thoughts and behaviours, physical impact and emotions comes together, is having physical difficulty with our physical appearance exacerbates anxiety, which we know makes some aspects of dermatitis, etc., worse. So we've got a vicious cycle going on, and we can't crack one without cracking the other.
Yes.
The other element of that is at the extreme end something we call body dysmorphic disorder, where people become so obsessed and focused on an element of their appearance, and it's a type of something we call obsessive compulsive disorder, that you need psychological input to take the emphasis away from this over-focused on elements of their appearance. And that's where the app and the low-intensity aspects can complement the more physical aspects and the medical treatment in this area.
Okay, very good. And what I'm hearing as I listen through these medical use cases is a very clear common theme where the fundamental nature of the psychological component must be part of the journey to treat the patient experience being supported. So thank you for those.
It's the psychological and the physical. You can't separate them.
Yes, they're integrally and intimately linked. Very good. So, thank you. Very interesting and really food for thought on the medical use cases. Maybe we could, in particular now, zoom in on the patient experience, folks. Keeping the medical setting in mind, are there other things that you can speak to on that, Aurora?
Yeah, I think the previous examples were about treatment and also mental health, but we have other examples where we are addressing something that's broader in COPD and respiratory in general. So Aptar Digital Health has a disease management platform, and here the challenge is really to support holistically the patient. There's an adherence component with add-ons to inhalers so that patients can track their adherence and monitor that they're taking both acute and base treatment. But there's also for them the notion of identifying the triggers of their flare-ups and managing the symptoms. So it's going really broadly, not only around the treatment. And as you said, I think mental health is a key here because there's behavioral impact that's involved in COPD. So it's another joint case.
Yeah, and this is a perfect example of where in terms of mental distress, mental health difficulties, one of the way they manifest itself is in the impact of the emotional on the behavioural. So for COPD, sometimes risk behaviours that people engage in predetermine COPD. So for example, smoking. COPD may be a reaction to smoking. What people tend to do when they have physical health problems is they may withdraw. So the impact of the symptoms of the physical symptoms of the COPD makes them withdraw. One aspect can be low mood, So we start reducing our activity, we stop engaging with pleasurable activities, our moods are affected. But equally, what it exacerbates is a deterioration in our physical health. And it's quite important with a lot of physical health difficulties to try and maintain a level of physical health, physical activity, because we know if we maintain that level, it maintains our physical health. So it's important to actually look at several aspects. Another aspect of this whole is, in Iona, we're well aware when we link with physical health, we have to engage behavioural change. When people go through a transition into physical health, they often have to give up things, or they have to do things differently.
Mm-hmm.
And that becomes a barrier. So built into Iona, we have behavioural change models, which, if you like, helps people understand how to do the things they used to, but in slightly different ways. Because
Sure.
physical health
Sure.
may not be a barrier itself, it's just people forget or don't understand how to get to the target which they're setting themselves.
Sure.
So we built that in.
Sure. Okay. Well, thanks, folks, for giving us a little bit more understanding of the patient experience and the patient journey. Then, if we now think a little bit about the benefits of these combined solutions for pharmaceutical companies, perhaps Aurora, you could say a few words about how you see this.
Yeah. Well, I think it's a fact that pharma now not only sell drugs, they are building experiences for patients. They've started with patient support programs to support their brands, but they're also going beyond. We clearly see that pharma are now more and more to go direct to patient, even in their commercialization channels. So building an experience requires them to find the right modules, partners, and this is where the digital solutions come into play. It's not only to help patients, it's also impacting key parameters that are important for pharma. Adherence to the treatment. In the end, we took the example of AD and skin-related disease. Sometimes patients have to stay for a while on the treatment before they see the benefit. So those digital tools, they close these gaps so that patients get the benefit and pharma gets the adherence. And final aspect is satisfaction with the treatment experience. It also builds the brand awareness around the treatment, the franchise, and what pharma brings to the market.
Sure, fantastic. Thank you, Aurora. And perhaps if I could turn to John, how you see the benefit of these kinds of solutions for the pharmaceutical industry?
Absolutely, yeah. I'll build on what Aurora was saying around how important patient satisfaction is with these programs, particularly in the context of integrating our solutions into a holistic patient support program. So Iona Mind developed the Iona Mind Development Program, which is a 12-week structured program where we work with specific populations around specific indications to really tailor and personalize our interventions specific to that population group so we can really maximize the satisfaction, patient satisfaction, as well as the efficacy. So by the time our products get into the hands of the patients, they feel very natural, and patients will say it feels as if we have a very deep empathy for the particular experiences that they're having. Another thing that's worth mentioning around how we work with pharma partners is the Iona Mind suite of solutions is really developed to give our pharma partners a 360-degree view on the psychological side of the patient, the psychological side of the patient experiences. We really focus on giving our pharma partners as much rich data as we can so they can deeply understand the patient adherence to our programs, the efficacy, and lots of other information they use to get that holistic picture so they can support their patients as best they can, so they can really differentiate themselves from their competitors.
Great. Yeah, and hearing you both just brings me back to the genesis of our partnership, because it's a question that our pharmaceutical partners ask us about how exactly the psychological component, the mental health needs are addressed in the patient experience. So yeah, delighted to have both your perspectives on that. And I'm going to also remind folks joining online, we're still taking questions. We are now going to look at the questions. We've had lots of questions, and thank you all for them. We're going to get through some of them. I really appreciated the conversation today, so I'd love to next focus on maybe the first question I see coming in is what sets this partnership apart from other solutions in the market? So perhaps Paul, did you want to say a few words on that?
Okay, so being a professor of evidence-based psychological practice, it's honor bound on me to make sure everything we do is evidence-based. So one thing that sets us aside is hundreds, thousands of these types of mental health apps, but very few, if you dig down, are evidence-based. Everything we do has evidence running through it.
Mm-hmm.
So we're based on low-intensity evidence base, over 30 systematic reviews of testing to the fact it works and it's acceptable. And the engagement with it is a lot higher because it's reducing this burden on people. So that's one aspect that sets us apart.
Mm-hmm.
The usability and the engagement, one thing that John mentioned was the efforts we go to work with patients where we're developing, simply because we know we have to tailor them. An off-the-shelf package, people may not identify it. For example, a medical health population, they will identify with a medical health problem. If you then present them a physical health problem, if you then identify them, present them with a medical health, they'll say mental health tool, they say I won't use it, I have to focus on my physical health. So we adapt them. So they're targeting the physical health but picking up on the mental health as well. What we do is we work with a range of stakeholders. So we don't just have focus groups when we're developing. We then, once we've developed a product, we will then send the product out in a controlled way, and we will get feedback through questionnaires on the usability, the acceptability. And what we can then do, because we're getting a bigger sample, we can then look at different groups. So we can look at equality, diversity as part of this journey and make sure that the product we're developing can suit different groups, different ethnic diversity groups, or indeed wider groups in the community.
Okay, very interesting. Thank you, Paul. And the next question we see coming in, I see a question. Could you please explain how Iona Mind CBT solutions have been developed and how these solutions demonstrate effectiveness? So maybe, gents, if we could answer this in two parts, perhaps Paul, you could speak to the evidence, and then John, I'm sure you've got a few words to say on how the products are then developed. Paul, over to you.
Okay, so we always take the starting point in England, the National Institute of Health and Clinical Excellence. Basically, as a panel of experts, they review all the research, categorise it, only use the quality research because there's a lot of not very good research out there, and then they identify treatment protocols, and those treatment protocols feed Iona. So that's the first starting point. What we then do is we start to generate our own evidence as well. So for example, we've got research studies at University of Washington, and we're looking at rolling out low intensity CBT across Washington State. And the Senate have just agreed to recognise low intensity CBT through a behavioural health specialist workforce in Washington State. We're working in Wisconsin in the Carbone Cancer Centre, and we're working with, I know it's not relevant here, but ex-service women. So we're tailoring our product to ex-service women, and we're looking at the evidence base. We need the quality evidence because that's part of what's setting us apart.
Sure. Thanks, Paul. And maybe John, did you want to walk through the other part of the question? I think is about how then solutions are developed.
Absolutely. So building on what Paul was saying, we take these gold standard evidence-based protocols and interventions, and then we use our product team to productize these interventions in a way that is acceptable to our population. So a really important part of what we do is getting our users engaged and adhering with these protocols, because we know these protocols and these interventions are really, really effective. The challenge is, how do you get people to do these interventions in their own home, at their own will? And we've got a world-class product team who work every day using models of behavior change, models of engagement, gamification, to make sure that not only are these interventions effective, but they're really engaging and patients want to do them. And that's how we drive the results that we do. We get those clinical outcomes.
Yeah, so I really think we've answered this question. Thank you both, gents. Next question I see coming in is, what experience does Iona Mind have in the US? Now, I know we touched on this earlier, but perhaps, John, you could just remind us of examples of experience in the US, and then I'll turn to Aurora.
Absolutely. So Iona Mind, from inception, is a US company. We
Okay.
operate in all 5 US census regions, and we work in regions as diverse as Michigan, Wisconsin, Tennessee, California, Boston, Maine. And we work with a range of different providers, whether it's pharmaceutical payers, providers. We even work with employers. We have a large employer presence throughout Tennessee. We've been working in the US now for around 5 years. We see this as our biggest market. This is where our main focus is.
Okay.
And over the last couple of years, we've just started moving into Europe, in the UK, but our core presence is in the US.
Sure. And then on the Aptar Digital Health front, being a global business, I can turn it over to you, Aurora, to maybe say a few words about I think the question is specific to the global and US footprint. So over to you about Aptar Digital.
Yes, so by nature, Aptar Digital Health has a global footprint. We have registered users across the globe by millions.
Millions. Yes.
What I would like to insist on is why the partnership also is particular with Iona on this is what you've just described before on the previous question with evidence-based patient centricity and also the right channels to distribute that. I think it's what makes us unique as a joint partnership to provide solution. And I also really love the personalization because as a user, as an individual, when you use Iona Mind, you realize how personalized the pathway is for you. But when you tailor that to a population, it takes it to another level. So,
yes.
That's unique, and I think it's also valuable in the US, as you said.
Sure. Fantastic. Okay. Now, I'm a little bit conscious of time. I think we'll take one more question. So this question is, where can I find out some more information on the solutions mentioned today? Aurora, perhaps a few words on that?
Yeah, so we'll be happy to publish content after the webinar about this collaboration and the solutions.
Okay.
And if attendees are interested by specific follow-ups, we'll be happy to organize specific sessions and demonstrations.
Okay. Thank you, Aurora. Thank you, Paul. Thank you, John. And so, most importantly, thank you very much to our engaged audience today for your participation, for the questions raised. We hope you enjoyed it. We hope that you learned some new things about mental health management after you leave the webinar, and also that you've got a better idea of what the Iona Mind and Aptar Digital Health partnership aims to accomplish together. And if you want to get in touch or learn more, we invite you to please follow Iona Mind and Aptar Digital Health on our LinkedIn pages, which you can see, we'll be showing them on the screen. Visit our websites. You can also fill out a contact form if you want to get in touch with one of our experts. And again, really like to take this opportunity not only to thank you, our audience, but to thank John, Paul and Aurora very much for coming today, providing some real understanding and extra colour on these real world settings, and explaining more about the patient experience, and for talking about the two innovative solution groups coming together to help people manage their mental health issues. It is Mental Health Awareness Day globally today, so I want to wish everyone a good Awareness Day around mental health, and thank you again for joining us.